Yes, 1990. I'm a bricklayer by trade. Do this as part-time stuff. 1990, I had a fall off some scaffolding. Fell onto my arm. Pretty much concertinaed up. Twisted my hand, so my wrist was up here and twisted in. It dislocated as well, so there was a lot of complications there. Straightened it all out, put it back together, but now I've got no movement backwards at all. Most of my movement's in my fingers, and I've actually managed to get them to bend back further to compensate for the wrist not going back. I've got it's come on over the years, but I've still got no backward movement. Lots of pain. Get a lot of pain in it, mainly in the winter. I don't know if it's just one of those psychological issues, but it still feels painful a lot of the time.
It's like people who, when it's damp, people's rheumatism plays up.
Yeah, and it's very odd as well, because when I go down to pick things up sometimes, I think my thumb's in a certain position and I end up stubbing it. It's quite strange. And when I'm washing my face in the shower, your hand automatically goes to the shape of your face, but this one stays straight, and I end up poking myself in the eye sometimes because my fingers won't compensate that way. It's quite a strange feeling, but yeah, that's basically it.
So we want it that way round. Is that right?
Yeah.
Again, if people want to manoeuvre themselves accordingly, please do.
That feels weird already. Just looking at that.
Right, couple of problems. Take your hand out. Can you please remove that?
Yes. Yes. That felt odd. Straight away. Right. I'll keep it back so I can't see my tattoo as well. It's different.
Right, before attempting to make any change to the bit that you're doing, just allow the illusion to build first. So take your time, don't rush anything, make all the movements that both hands can make as a mirror image of each other.
Yeah, I'm trying to get this position to how it feels in the box. Yeah, probably more like that. I'll just have to move it out a little bit because I'm just actually clipping the inside of the box there. And this is good because obviously I didn't have a scar on the wrist before, and now I can see my hand as it was with no scar. And the muscle on my thumb has actually deteriorated as well, because I've lost a lot of strength because I've got no backward movement, so I've lost a lot of the forearm muscles as well. Yeah, that's really weird. It actually feels as though it's bending back now, whereas normally it feels very, very stiff, extremely stiff. The way it locks out, but that actually I'm watching it bend back, and that's 24 years ago. 1990. That's incredible. Hey, it's bending. It's actually bending back. It doesn't feel like there's any restriction on that at all. It just feels as though it's obviously stopping inside the box, but I can see it's actually moving, and it feels as though it's actually facing that way. Yeah, that's Weird. Just that's incredible because it doesn't bend back, but it's bending back, and it feels as though it's bending back. I can do all these movements. Obviously I've got that rotation there. I've got very little inward and nothing outward, but that's turning out. And I'm feeling it turning out to its lock-off position there as well. It just feels exactly the same. Looks it, feels it. And then fingers, to me, are pointing that way, whereas inside the box they'll be pointing straight in front. I've not lost my arm, and I could sit here for hours as well. Just noticing that I've not got, because I've got a scar right down from the palm, sort of 4 inches up my wrist, and one on the back of my thumb as well, which goes sort of six or 7 inches up, and I'm not seeing that now. Yeah, it's bending back. Yeah, that's incredible. It's amazing. Yeah.
How does it feel once you take your hands away from there?
Without me looking at it, it just feels like this one.
Have a look at it.
And now I can see it's all crooked because it actually offsets. It's slightly offset because of the way they've set it. Yeah, and that feels more odd now again. Although the feeling, it doesn't quite feel the same. I know it's restricted. It just feels like it's bending back a little bit more.
It looks like it.
Does it?
Yeah.
Quite a lot.
Is that? Do you think that's the? You know, where, as I said about the fingers compensating.
There's a quarter hand.
Yeah. Maybe it's not locked as much as I think it is, and this is allowing it to actually. They were going to manipulate it in surgery, but the nurse advised me not to bother. You might not want to do that, she said. But yeah, it's. Just get my tattoo out of the way.
Somebody's very tattooed. Would you wear long sleeves for this?
Could do. A lot of it's going to depend on what the phantom's like. Some phantoms are clothed, you see, and some the phantom, despite the phantom itself may be illogical, the clothing might be logical. So you get this weird kind of. So you have to take it on a case-by-case basis.
It feels like that one feels when that one's locked out there. And in my mind, that's how it looks. That's how that limb looks. That's really odd. I know it's not anywhere near like losing a limb, but just losing the use of what I can do with it that we all take for granted. It's so different to actually experience it doing the things that it used to do.
Andy.
I'll get one of these for work,
Yeah.
and then I can lay bricks through the box. And I won't be stuck
What's just
yeah.
come into my head is several years ago I had a hip replacement. Do you think a method like this could help speed up the healing process and reduce the pain in, say, prosthetic joints?
I don't know.
Just from watching Carl there, I just thought it's suddenly just. I thought, God,
But it's
I maybe could have got a little bit more.
Is
a bit more
weird.
quickly.
The problem with the hip is getting the visual feedback, because how much of the what we do here is
Yeah.
reliant on visual feedback. With hands, we do lots with hands. We don't spend so much time watching our feet.
No.
So I suspect it may well have a place and a role, but probably if there was a hierarchy, hands are going to go first, and the most
Yeah.
effective. Feet may come next. Everything else will then become less significant visually.
Is that the procedure you have to reteach yourself to move your leg again?
Yes.
I'm thinking, well, maybe if I'd have seen my other one,
Oh, I see what you mean. Yeah.
then it
So-
might have actually accelerated the movement.
that
I think
mental rehearsal
maybe.
Yeah.
enhanced, isn't it?
I don't know. I've got no first-hand experience of that. I have a suspicion, though, someone somewhere is doing a research project on that, because the amount of people, the network that I've been involved with, I couldn't believe how many people are doing research in this kind of work. And some of the things that people have discovered is remarkable. So, for example, there are physiotherapists on the research project who are getting great results with long-term contractures using this approach. I saw a video of a lady who, after following, I think it was a head injury, was paralyzed in one hand, and it would go into a contraction. She couldn't move it. There was no conscious ability to move it whatsoever. And no matter how much she willed it to move, it just simply didn't. And she could try and move it, manipulate it, but it would always go back to that position. They put a mirror, and instantly she can move it like a most perfectly normal thing in the world, as long as and as long as she's doing that, the moment the mirror goes, straight back. I mean, it's the most extraordinary effect. But that wasn't a damage to the limb. That was elsewhere in the brain. I can't remember what had happened to her. So I think there's a lot of potential. My concern with this is, which was my concern with the complex regional pain syndrome, was that I was disbelieving of that, simply because I go, okay, that works for phantom limb extremely well. Is this a case of clinicians taking one idea that works and applying it to everything in the hope for the best? But it turns out that they were quite correct. It does work extremely well. So who knows?
I mean,
Actually, I say who knows. Someone probably does know. I'm not aware.
the difference is that in his case, or in this case, is still you are getting information. Your brain is getting information from the proprioception, plus from the visual stimulus as well.
Yes.
But then the brain will integrate, and as a very good computer with good software will create something else.
Yes.
So it will be different, or potentially it's different, isn't it? It cannot be the same because you are getting different.
Right. The other effect, of course, is that what we now know is not everyone's brain is wired the same way. The generalizations of old about neurological function don't hold up, and that we now know that there's so many counterexamples to the generalizations. The conclusion is that not everyone has the same organization in the brain. So. Any other thoughts or questions for anybody, for Carl or myself?
How's it feel now?
Pretty much how it was before. There's not been any pain in it for a while. It sort of comes and goes, that does. But I'll be interested to try this when the pain does start kicking in again, and just to see what difference that will make. Obviously now it's back out of here, and I'm not actually focusing on this. This feels very restricted again. So it's sort of as it is. But you know, maybe working with this more often will make that feel a little bit freer. It might actually start releasing that. But I know there's a lot of build-up of whatever there is on the back of the bone, because it's shattered all around here. But it could be in here that's the reason why it's not bending back as much, because of the trauma that occurred with that. I don't know.
Close your eyes for a second. Let's just try something. When you think about your left hand and wrist,
Yeah.
and in terms of how it looks
Yeah.
compared to the right, how does it look in terms of what you've just been describing there?
It looks cooked over. Yeah, like that.
All right. Don't move. Let me just describe it again.
It feels, wow. If I look at it,
Do you see the disparity between how the hand actually is and his mental image? So this would for me, this would suggest why this is getting a result for him.
it's sort of turned inwards and cooked over.
Right. But of course, that's not what your left hand is.
No. That's just how it looks.
Yeah. So for me, what we're doing is we're changing the image of that he has, which would suggest why it's effective. All right, thank you, Carl. Right, oops. Steady. Did you want to, because this is an unusual one because it's not phantom limb. It is, as I said before, it is possible to have the limb present and have a phantom at the same time. It seems like a bit weird, but it's perfectly logical. From what we've talked about before, it doesn't seem there's any phantom phenomena, but there is pain in the limb. And I say, from discussions with people who know far more about the biology behind this than I do, I've been advised that this is okay to experiment with to see if this will be effective. As I'm saying, there's no contraindications as to why we shouldn't do this. So I don't know which one will work best for you. We'll let's find out. I'll just say what I'm going to do. Just follow the health and say. I know.
You need to turn it round
Yeah.
this way.
Well, we can do it
That.
like that.
Oh yeah, sorry.
Does that work?
Got the wrong hand. It's a bit sad, but it's just lovely to have it back. Mm. Now, because my arm doesn't move, I don't quite know what to do now.
Mm.
Except just look at it a bit. This is a bit peculiar because I'm moving my index finger on my left hand, and
my right hand is completely paralysed except for the index finger, which kind of feels like it's lifted off the table a bit, which is quite bizarre. That's really peculiar. As a matter of interest, the pain has subsided quite considerably.
You carry on there. I'm just going to talk here. Doesn't it feel like a long time has passed? Actually, it's probably, what, 4 or 5 minutes? Not if you're on this end. This is why I say one of the best things the clinician can do is go somewhere else. Because otherwise, you're like, oh, God, another 4 minutes of this. Oh, no, it's going to go on for another hour. It just feels like forever. So the overwhelming temptation, like I'm doing now, to do something to fill the void.
Kind of a nap.
Yeah, it's probably quite useful. So I always think if for clinicians working in a clinical environment or a hospital setting, it's quite good to find a small treatment room somewhere, set the person up. They can leave them and periodically go back and just glance around the door.
Quite peculiar because it feel like I can feel the table with my right hand.
So I'm going to interrupt because I suspect otherwise you'll be there all afternoon. I mean, I don't mind, but I understand people. How does it? What's it like now? He's taken it out.
Okay.
It is. It's quite hot in here as well.
Yeah. Okay. That's so bizarre. I felt like I could feel the table.
And now you've taken the hand back out.
I mean, there's a little frisson of pain and discomfort, but not as it was. And this is kind of my witching hour between 3 and 4 is absolutely a killer for me. And I don't know why that should be, but every day, you know, with numbing regularity.
Put him back in. Let's see.
It's strange because I'm trying to visualise moving my right hand. That's what you want me to do, isn't it? Yes? Not just move my left hand. Just shrugging.
Really, really important. Okay, don't get suckered in, because then what we have now is an expectation set that is going to attempt to be met. It's much better to find out what does happen rather than try and make something happen. Now again, it can appear that for the person doing this experience that nothing much is happening apart from looking in the mirror. But I know that's a very busy brain going through the whole kind of, whoa, that's... Which I'm going to interrupt because otherwise, well, you know, I can see we'll be here till next...
Doomsday.
Yeah, probably. Yes.
Thank you.
Okay, thank you. Are you like to take any questions for anybody?
Yeah, sure.
Does anyone have any questions about that?
Andy, have you ever experimented, when she had her hands there, on her left hand, of covering the left hand over so she can only see in the mirror? So you can only see her right hand, visually, and her left hand's hidden.
Yeah, that is. It doesn't make any improvement in it. I had initially, when I was first doing mirror box work, that's exactly what we did. So essentially, so there's that arm that still exists. There's the phantom. We engineer it so all I can see is that, because this one has a cover over it, and it's only the reflection that can be seen. It works just as well, but I wasn't getting any significant improvement on it. One of the video sessions that I got on the website, I'm trying to remember the exact detail now, that was with a leg where the guy asked to have that done. And so that was his request. He said, oh no, it'll make it better if I can't see this one. And so we got, there was somebody who was there helping. I got his jacket, I think it was, and then put it over his leg. And then, oh, wow, that seems to help. And so, yeah.
Because what was going through my head in that example was, if that was covered, you could also introduce a sensation into the mirror hand by sort of touching it, because that would be the only one you could see. So it'd be interesting to see what feedback came.
Interesting.
Whereas
Yeah.
if you're touching both hands, that's going to have a different perception. Where if you sort of, it appears like you're only touching one.
Yes. Now I got a reservation with that. So essentially, what we're doing is we're putting physical sensation into the phantom, or the one that's not there, to make it real. It isn't real, and what we're trying to do is relieve pain. If we create, we're not. I don't think for a second, because she said she could fill the table. Oh my God, is a chance that I don't. I think that's incredibly unlikely. What I don't want to do is to increase that to an unrealistic expectation set. So that will be my reservation, but I will ask some of the people that are doing the research and see if that's something they've experimented with. Because I don't know. My prediction, I have a reservation about it, but having never done it, I don't know on that one. But it could be interesting. I think if we got debility, like in Carl's case, where that could be interesting. If that, if it's something like that, but a little bit more extreme.
Can I just ask which sensation felt stronger, the pressing on the table or when you're slightly raising your finger?
Well, this hand whilst in the box and whilst this pretending to be this hand felt incredibly heavy. And moving this finger was a supreme effort to think that this was moving, I think. So it made this hand feel really heavy. So this hand is heavy and felt heavy, and in trying to move this hand, if you like, by utilising this hand that was there, this hand then felt incredibly heavy as well, which I think was why I wasn't able to go like that. Because actually I didn't feel like I could do that with this hand.
Yeah. Because you can't.
Did you
Because
get,
I can't.
did you get the cool sensation as well?
Cool.
From the table? The coolness? No.
Not particularly. I got the pad sensation on my fingers, which was really nice.
Yeah.
And, just a nice feeling.
I suppose the more you do it, the more things might come out.
I guess you get more used to it. That's the first time I've ever, actually, the second time so there's 4 times I've done this mirror box stuff, and that's the second time that I was completely focused. The other 2 times I've been distracted and chatting while I've been doing it, and the results of that have been far better. When I sit and watch and watch and watch, my logic is going, yeah, but you can't move that hand. So it's almost like a little bit of distraction works very well for me when I'm looking, because I'm glancing away, I'm chatting, I'm doing, other stuff, and my hand is just there looking like my hand. And that pleasurable experience of pushing my hand down, and that first glance, it's just like, wow, that's kind of my real hand. It's really bizarre stuff going on. But distraction and doing it, I think, is much better for me than focus. It's probably mind blowing, really.
Well, any other thoughts or questions? Because if not, we're gonna round up and finish. I don't know what I'm going to do to round up and finish, because I've said everything I've got to say. So trying to think now. Conclusion. Didn't think about that one.
Move away from tradition.
What, just end it?
Yeah.
Go, right, we're going home. I think that's probably quite a good plan. Should we put the air conditioning back on before we all? Can somebody just press the button, please, everyone? And before we all roast.
Yeah.
No, keep going, because I'm just gonna quickly. So just if anyone wants me to send them over a list of that, if you haven't written it down, I can do this. This is the sequence to follow if you're working with people. You have to be prepared to allow a good portion of time, or to simply see the session as an educational process that the client can go away and do it in their own time without you being present. I've only got one example of where there was a problem that I can think of. in the research project that was being done, they were looking at what are the negative things that can happen with the mirror box. And mostly people go, well, there might be a bit of distress, they might cry a little bit. Well, I've got to say, my experience tells me that's because most people who are therapists are frightened of people crying, which is why they immediately hand them tissues to stop crying, because tears is banned from the treatment room. So I didn't really see that as a negative or something that shouldn't be happening. I've got one case study where there was a problem, and that was at this point in the session, the guy flipped out. By flipping out, we're talking, I'm going to run away and kill myself, and there's nothing you can do about it. Now, the problem arose primarily, this guy was a high-risk individual in a high-risk lifestyle with a history of mental health and drug abuse. So there was a problem there, but there was no assessment or treatment in the plan before they exposed him to the mirror box. Now, he got exposed to that, which was too much for him, and he's histrionic. So this is the kind of thing he would jump on and exploit for maximum effect and attention. Now, what's happening is the physiotherapists who were attempting to treat him are now in a terrible state because this man has gone running out of their clinic, screaming that he's going to die and kill himself. And they're not quite sure what they're supposed to do or where their liabilities are. The only thing I said was, well, as a physio, there's not a lot you're going to do about that. But really, that was where that should have been accounted for in the first place. They were seeing the mirror box as a pill. It's a prescription you give a person, and then that makes them better. They weren't seeing it as an exploration process. But that's the only one I can think of, apart from the stuff from way back in Rwanda, which was people freaking out. Personally, I've not had any. There's a video on the website which at the time caused me a lot of stress when we were filming it. The guy's on the floor and he's got the mirror is between his legs like that, and then he starts to tell me that the leg is, I think it's either through the floor or behind him or something. And the more he talks, everything he's telling me sounds, oh, that doesn't sound good. There's nothing about this that sounds pleasurable, pleasing, or relieving. Afterwards, the feedback from him was, that was amazing, I loved it, I'd do it again. But the reportage he was giving didn't sound, because it didn't sound logical that would be a positive. The one thing I've learned is just trust in the process. Just allow that process to continue and see what happens afterwards. Personally, apart from that one instance of the physiotherapist working with the guy, I don't see any problems that can emerge yet. But with the gathering of more data, they may well do. The most common thing I'm seeing is therapists frightened of clients' emotions. And that seems to cause them the most concern. And they tick all these boxes. Oh, they look like they were going to vomit. The mirror box causes nausea. Doubt it. Very, very unlikely. So I'd just like to say thank you very much to everybody for coming along. Thanks to Reggie for his been indispensable.
I've got a question for you.
Oh, questions? Yes.
Would you ever split that up, do the assessments?
Yes.
And then bring it back?
Right, my assessment is done on the phone before I meet the person. So what I'll do is I'll run through all the things I'm aware of, and my assessment basically is to run through that list. That's what I'm doing. And then I also have the question, I explain them to them remapping, and most people are like, wow, how I get it, there's a name for this? If they got remapping and they don't have any of that, then I'll book them in. If they don't have remapping, they've got all this going on, and their limb, the phantom doesn't move. Okay, well, I'm going to have to rethink. I think the likely outcome is not going to be good with the mirror box. So I'd be looking at other approaches. And I'm not saying mirror box is the only way to treat phantom limb pain, but it is easy and it's very effective. So yeah, so do split it up, and don't try the mirror box too soon if you have all of this as issues to deal with too, and involve other agencies with people.